friends. Thank you for tuning into our presentation for public and preventative health concerning what our population of those 60 years or better can do after receiving the COVID-19 vaccine. This presentation has been put together by Jonathan, Blake, Connor, Bailey, and Daneel. A little background information about this presentation. We know that the target audience is a population of individuals who are 60 years or better and have just received the COVID-19 vaccine. This population may have limited access to electronic sources of information, such as social media, when trying to learn about post-vaccination guidelines. Since this vaccine is still a new product and guidelines are continuously being updated, we needed to find an appropriate and efficient way to get information to our specified population. News outlets such as newspapers, local radio stations, major or local television programs seem like the best way to relay this important information to our audience. While going through the planning process and execution of this intervention, we needed to consider the types of resources available to our population, such as the newspaper, radio stations, or television programs. While not all of the individuals in this population have social media, some do, and others probably know someone who has access to social media. We could hope that by posting information on social media platforms that the generalized information would be relayed to our target audience by either friends or family members. We decided to approach this topic using the ecological model, as we felt that the multiple levels of intervention would allow our health promotions to be the most effective. Many people in this population rely on the community to get the majority of their information, as mentioned, through outlets such as newspaper, radio stations, and other televised programs. The individualized and community-centered approach of the model would be important because the amount of information about COVID-19 in the news or other television programs can be a bit overwhelming and unfortunately not always as accurate as we would hope. By offering in-person and online instructional learning, it would be a great opportunity for community members to ask questions or get clarification on information that may otherwise be fuzzy or still a little bit confusing. These community events would also be a great time for the population to learn what safe social distancing can look like as they gather to learn about the things they can do in the community after receiving the COVID-19 vaccine. To properly implement this type of community intervention, we would need to find reliable healthcare professionals to work with us to ensure that we are providing the most recent information for our population. We would also be working hand in hand with these healthcare professionals to ensure the proper guidelines are being met. While people in the healthcare field, such as ourselves, would be fine understanding what these guidelines mean, we would need to ensure that this complicated information is being properly translated so that the general public, specifically those 60 years or better, are able to understand what life will look like for them after receiving the COVID-19 vaccine. One challenge would be finding the reliable healthcare professionals to work with us in creating these community events for our 60 years or better population. We would also need to be conscious about paying for airtime or advertisements on radio stations and television programs. We would also need to be established within this community and be a trusted source of information for our specified population. They have had a lot of information just thrown at them regarding COVID-19, and we don't want to be just another person spewing info at them. We actually want to be heard. While many people in this population may be worried about following guidelines, we want to ensure that they are given the most accurate information so that they can be safe within their communities after receiving the vaccine. But since guidelines change frequently, we need to ensure that we are staying within the lines of legal state and federal laws. By providing these guidelines, we can gain the trust of our targeted population and encourage them to continue coming to us for new guidelines. The best way to evaluate how successful this intervention is will be to look at the number of people utilizing our resources or coming to the hosted educational events. We would want to see an initial surge in the number of people accessing our health policy and over time a reduction in the number of people attending. This decline in attendance would be an indication that the information we've provided is making its way out into the community. Surveys or questionnaires would be the simplest way to analyze the effectiveness of information. By getting feedback directly from those in attendance, it would help us to improve the presentation of future events. In conclusion, after finding our target audience, we would use reliable healthcare professionals to put community events together, as well as advertising information about current health guidelines through platforms such as TV, radio, or newspaper. Using these reliable resources, we would be building trust in the community and continuously updating the information for our health promotions to better serve the population and be an advocate for health and a well-functioning community. Thank you for taking the time to view our presentation. Best wishes to you and yours, and please stay safe.